Oklahoma's budget crisis is also generating fear among those who rely on the state's long-term care facilities. They're concerned that the Medicaid cuts could force most nursing homes in Oklahoma to shut their doors, leaving many of the state's most vulnerable residents with no place to go.
83-year-old Bessie Mayo has been a resident at the Noble Health Care Center for the past 4.5 years, but now she's worried that she may have to find someplace else to stay. Her fears stem from talk of possible cuts of up to 15% in the appropriation for the Oklahoma Health Care Authority, cuts which could have a devastating effect on Oklahoma's nursing homes.
Well, it concerns me depending on what they're going to cut, how much they're going to cut, and where it's going to be cut.
Lawmakers asked the Oklahoma Health Care Authority to present possible scenarios for what would happen in the event the agency is forced to take cuts ranging from 5 to 15%. Representative Chad Caldwell is chair of the Appropriation and Budget Subcommittee on Health.
That certainly isn't our goal. It's a kind of a starting point for a conversation, and hopefully our members understand the true impact of what a budget cut would have.
According to the Health Care Authority, a 15% cut on appropriations would result in rate cuts to Medicaid providers of 25%. Oklahoma Association of Healthcare Providers President Nico Gomez says that kind of cut would be catastrophic for Oklahoma's nursing home industry.
If the state said to the Health Care Authority, we're going to cut your appropriation by 15%, 14.5%, and if they were to turn and basically say, okay, healthcare providers, we're going to have to cut your rates by 25 or 30%, you're nearly closing every door of every nursing home in the state of Oklahoma.
The Oklahoma Association of Healthcare Providers estimates that a 25% reduction in the Medicaid reimbursement rate would result in 93%, or 269 of the state's 289 nursing homes, becoming insolvent, putting 16,800 seniors at risk of being displaced. That, in turn, would lead to 16,900 lost jobs and $495 million in lost wages. Anna Diaz, the administrator of the Noble Health Care Center, says they certainly could not survive a 25% provider rate cut.
Right now, it's already a $15 per Medicaid resident loss. And with a 25% cut, we're talking $40 to $50 a day loss. And there's no way a facility, a business, anybody could operate at that big a loss a day.
Gomez has been down this road before. He was head of the Oklahoma Health Care Authority last year when there was also talk of a 25% provider rate cut.
And we went down to the last week in May before the legislature got to an agreement and said, we found money and we don't have to cut rates and we'll all move down the road. And that was a very stressful 2 months that we were sitting there trying to figure out, how are we going to run this program? How are we going to serve thousands of Oklahomans across the state of Oklahoma who rely on skilled nursing care?
Mayo says she doesn't know what would happen to her if the center were to close.
I have nowhere to go. I have children, but then they have children and so on, and it's not a really good place for me to be with my children. And it would just be, where would we go?
And living on her own is not an option.
Even in this wheelchair now, I have to be pushed everywhere because I can't put any weight on my hips, and especially my left hip. I have no hip joint there, so I can't put any weight there. So it's a real problem.
Even if family members were able to take them in, most of the residents have needs that have to be provided for, something most families aren't equipped to do.
These people are here for medical care, and they don't have people that can give them medicine 24 hours a day, or know what they're giving them, or meet their nursing needs that we are able to do.
It remains to be seen whether cuts will reach catastrophic levels. Representative Caldwell does not foresee appropriations to the Health Care Authority being slashed by 15%.
I would say that it's an absolute worst case scenario. I would be, I think, shocked. It couldn't be maybe even stronger than that if that's really where we ended up. I think, quite honestly, a cut of that magnitude simply isn't doable, isn't sustainable.
Bessie Mayo hopes that it won't happen and believes lawmakers need to put themselves in her place and remember that someday they may need the skilled care that a nursing home provides.
And I never gave it a thought that I might be here or even live this old. And but here I am.